Welcome to my YouTube channel. I'm Dr. Melanie Watkins, and today's topic is what do I do when my loved one has mental illness but doesn't want to seek help? This is a common concern that families of some of the patients that I see have. How do we get our loved one to go to a doctor's appointment when he or she doesn't feel that they have mental illness? Well, I'd like you to start off imagining what it would be like for you if you went to the doctor and the doctor just having, the medical assistant check vital signs, documents that you have elevated blood pressure. And you might say, well, gosh, doc, I feel perfectly fine. I don't have any headache, dizziness. I'm exercising like I want to, and my weight seems to be under good control. But the doctor says, well, I see your family history and I see the numbers here, and it's been trending upwards each visit, and I think that we need to start you on some blood pressure medication. So there'd be a period of time where you'd think, wait a minute, is this really what's going on? Me be on blood pressure medication and I'm healthy. I don't really need this, do I? But then you would learn more about the consequences of not taking that medication. Consequences such as stroke, heart attack, all kinds of things that can go on if you're not controlling your blood pressure. And so most people will eventually decide to go ahead and go with the doctor's recommendation and get started on blood pressure medication, which they'll take daily, indefinitely. So when your loved one has mental illness, it's similar in that they might feel fine. I'm living my best life. I have all this energy, or, I'm feeling so creative. I'm not needing to sleep much. And everyone else around them can see that it's a concern, but the patient doesn't see it. And so, why do I need to see the doctor? You should go see the doctor. And so sometimes the patient will say something like that, and we call that projection. I don't have the problem, you have the problem. Are you taking your meds? Don't ask me if I'm taking my meds. Are you taking your meds? That kind of thing. And so I think it's important to start off with validation and just acknowledging that, it must be really difficult to see so many people around you feeling concerned and you feel perfectly fine. I know that would be hard to accept or understand. And I can imagine being myself in your position and thinking that other people must have the problem because I feel fine. So you just want to validate and show the patient that you do get where they're coming from. The second recommendation I have is to use carrots that you feel comfortable with. These carrots might be rewards such as food. I'm okay with using food sometimes as a bargaining tool. Sometimes treating the patient to a meal at their favorite restaurant after the visit can be helpful. Sometimes that carrot might be money. Some families have used that. Sometimes it might be, shopping. We're gonna go to the mall after your doctor's appointment. And sometimes those things can make a difference. My next recommendation is to allow choice. And the reason why I'm using the air quotes when I say choice is that when my son, Jonathan, was very little and I needed him to eat veggies, I would say, okay, is it gonna be broccoli or spinach tonight? Now, either way, he was going to get his veggies, but I wanted him to feel that he had some say-so in the matter. So same thing with the patient. Okay, well, here are 3 psychiatrists who are willing to see you. How about you take a look and you let me know which one you might want to see? I don't want to see any of them. Well, you're going to be seeing one, so maybe pick one that you might feel more comfortable with. It's like, oh, okay, I'll see this one. He or she's close to my age. Okay, good. So you allow some choice. And that helps versus making it a yes or no, or will you or won't you. And sometimes too, along with that can be consequences if the patient, your loved one, doesn't go to an appointment. Well, if you're not willing to see Dr. Smith, then we need to talk about what some of your privileges, how some of your privileges might be changed as far as access to the family car or other things that the patient might really like, their Netflix account, etc. The next is offering support, and that support can look differently depending on the patient. So for some, that might be you drive them to the appointment. For some, it might be joining in on the appointment. And for others, it might be your support is not being involved in the appointment. So, you stay out of it and allow the patient to have the relationship with the doc. And then, as time goes on, ideally, the whole family be involved and know the doctor and know what the plan's going to be. But maybe initially allowing the patient to have some autonomy in that way. And that's a way that you can support them. And you can ask them, how can I best support you in this? Do you want me to talk with your doctor? Would you rather I not talk with your doctor right now? So think about some ways in which you can support your loved one to have a better experience. My final tip today is to personalize it. It's okay to use an I statement and say something like, I worry about you when you don't take your medications. I know in the past when you didn't take your medications, you would end up in the hospital, and I know that's a place you don't like to be. Or something like, I want you to be able to attend school. You've shared with me that getting your degree is super important to you, and I want that for you. I want you to be successful. And I think that getting back on your medication consistently and seeing the doc would help you to achieve that. And I want to support you in that. So it's okay to use some I statements there. Trying to see how that might help support the patient. And also supporting yourself, right? So it also shows that the patient hears that you know what their goals are. So something like, it would make me so happy for you to be able to have your own place. I know you've said that you want to be able to move out and live in your own apartment, and you don't necessarily like being at home all the time. And I want that for you. And I think that one of the ways to help get you there is getting consistent help. So those are my tips today. And it's a challenge having a loved one who has mental illness, who doesn't recognize that they have symptoms that are affecting not only their own lives, but the lives of others. But with tools, you can learn how to live a better life while also supporting your loved one who has mental illness. So I want you to take good care of yourself while you're taking good care of others, and I'll see you next time. Bye-bye.